So in one of the at the beginning, right, what I mentioned was that a lot of our patients are looking for non-pharmacological type of treatment options for their vestibular disorders. Because there can be a very holistic type of approach to treating vestibular disorders. It just does not necessarily always mean only medications. It can be added other treatments to the plan. We divided them up. So, part of it, I talked about neuromodulation, which is, using certain devices that stimulate peripheral nerves and that alters the brain's function from there. Two of which would be non-invasive vagus nerve stimulation, like the gammaCore device, and another is the external trigeminal nerve stimulation, or the cephalodual, which is put on the forehead. I also discussed the role of, acupressure and acupuncture in some of our patients. Also covered certain vitamins that could be useful in people with vestibular disorders. So from the neuromodulation standpoint, the good thing about the devices is that, there's pretty solid scientific evidence that it helps these vestibular disorders. Now, that being said, they are not FDA approved for vestibular disorders. They are FDA approved for treating migraine and headache, right? With the gammaCore, it's cluster headache and migraine. With the cephalodual device, it's migraine headache. But off-label use for vestibular disorders has been shown to be quite helpful, right? We did a study where we showed that the gammaCore device helped patients for vestibular migraine rescue. And the cephalodual will also help with, vestibular migraine rescue. Anecdotal evidence is personal experience from my patient population. I find that, these devices also help with migraine prevention. So when we say vestibular migraine prevention, we are targeting mainly vestibular symptoms in this patient population. Excuse me. There is also some evidence that, the acupressure, like in the P6, which is on the wrist, can help with people with nausea, with motion sickness, so we did cover that as well. There are many, nutraceuticals, which also can help people with vestibular disorders. For example, if you have vestibular migraine, certain supplements like B2, magnesium, feverfew, coenzyme Q10, and vitamin D could also help, in those conditions. In addition to all of that, we did discuss like how ginger, ginkgo, and vitamin D can also help vestibular disorders, even if you do not have a migraine disorder. So the main problem is usually cost when it comes to the neuromodulation devices, unfortunately, right? When it comes to, like, say, acupressure is very easy to do. And when it comes to the nutraceuticals, it's fairly, cost effective in general. Cheap, a lot of times, but not prohibitively expensive. The devices can be somewhat expensive, so, costing like several $100s at least, and that can be out of the reach of some of our patients. Unfortunately, a lot of in the US, a lot of the insurance companies do not cover devices, and so that can be a little bit of a hindrance. Unfortunately, not much we can do to get around that.